The environment has become...
What we're saying is have a heart.
We've got to be able to regenerate our
There'll
economy.
be people who are kind, people who are cruel, but that's life. You can be bigoted about pigeons. I'm fine with that.
Good evening. Welcome to Talkabout. HIV originated from a species of chimpanzee in Western Africa, possibly through the consumption of its meat. The earliest known case was detected in 1959 in the Congo. Statistics indicate that almost 70 million people in the world have been infected with the HIV virus, and about 35 million, or half of them, have died of AIDS. AIDS being the full-blown version of HIV. At the end of 2011, 34 million people were living with HIV, with the burden of the epidemic varying from country to country. In Singapore, the government's aim on HIV-AIDS is zero stigma, zero deaths, and zero new cases. But despite these worthy intentions, the number of new infections has been rising. Since Singapore's first case in 1985, nearly 1,600 people have died from the disease, and about 5,800 have been infected. Sex is the main mode of infection in Singapore. Although the fear of this incurable disease over time has become somewhat moderated, with better treatment and understanding of the disease, HIV-AIDS has not gone away and is not any the less of a threat today. Tonight, Talkabout looks at HIV-AIDS with a panel of men and women working on the front line of the disease. We have a psychologist, a doctor, we have AIDS activists, we have a member of the NGO, and somebody who works on community relations from a commercial firm. May I introduce the panel tonight, starting with Dr. Leong.
Thank you, Kenneth. I'm Dr. Leong Ho Nam. I'm an infectious diseases physician in private practice. I look after patients with HIV, patients living with AIDS. I've been doing that for the last 10 to 15 years.
You are an infectious diseases specialist.
Yes.
And what are the diseases that you handle?
So we
apart from AIDS?
Apart from AIDS, we look after patients with fevers or infections of various sorts, or anyone who has suspicions that they may have a viral, bacterial, parasitic infection. We also do preventive work in this, such as in vaccinations and preventive work in getting other forms of infections.
Okay. Now we have James Fung from Action for AIDS. James, tell us about yourself.
Okay, hi. I'm James. I'm volunteer for Action for AIDS. Actually, previously I was working with DSC Clinic. This is a public health clinic for STI, and also I've been helping out for Action for AIDS for some of the programs and volunteering.
What does helping out involve?
As in doing some of the programs and also volunteering as some of the programs that they have been running. So,
programs, are these educational programs or are they assistance programs?
Some of the outreach programs.
Okay.
Yeah, so when they have outreach programs they require volunteers, I'll be helping out. Yeah.
We also have Joanne Sim, one of the only two ladies in the group. Joanne works with Standard Chartered Bank and she deals with community relations.
So I'm Joanne, look after the community investment programs for Standard Chartered, one of which is the workplace education program called Living HIV. So we have HIV champions that deliver HIV education in the community. Is
work on AIDS part of the focus of Standard Chartered?
It is one of our global focus.
Global focus?
Yes. So globally we have a HIV education program that different champions around the world deliver. It's a minimum standard HIV education.
Okay. And Terry also is from Action for AIDS.
Action for AIDS.
What do you do there, Terry?
I'm a program manager with Action for AIDS, specifically targeting at the heterosexual area, doing outreach, event, reaching out to people. More preventive work, preventive programs.
Okay. My left we have Evan Tan. Tell us about yourself, Evan.
Hi, I'm Evan and I'm the second person in Singapore coming out publicly as a person living HIV, and I've also been with Action for AIDS for the last 5 years. So in the past, it's very similar work with what Terry does, so coordination, outreach, and then increasingly I'm doing public education, corporate engagement, and since I've come out, I'm also the spokesperson for Action for AIDS.
Susan Solomon.
Hi, Kenneth. I'm the Executive Director of the Business Coalition on AIDS in Singapore, and because it's a very small setup in Singapore and because of sort of general attitudes, I've been seconded to become the regional trainer for the Asia Pacific Business Coalition, which is based actually in Australia.
What does the Business Coalition for AIDS do?
Well, what we do is we educate companies top down.
Okay.
So we've set up in 11 countries around the region, like Mongolia, we're in Thailand, Cambodia, Nepal, Fiji, Indonesia, and in Papua New Guinea, which is one of our biggest. And so we educate companies, we work with companies mostly.
And why is it important to target companies and not people?
Because I think particularly with multinationals, they have the ability to get around the region much more quickly and educate top down, and then of course the information also expands out through families and so on within the company structure.
And has this anything to do also with how people with AIDS are treated at the workplace?
Of course, what we try and do also is implement policy. For me, that's one of the most important things that we do, is to create a policy for the company so that, you're also talking about stigma and discrimination and all the other issues, health benefits and so on. So it has a tremendous knock-on effect into the community. So it's corporate social responsibility is what we deal with.
While AIDS may be a physical condition, I think people who suffer from AIDS also have to go through a lot of emotional and psychological difficulties. And we have Dr. George Bishop here, and he'll tell us what he does.
Yes, I'm George Bishop. I teach psychology at both NUS and Yale NUS College, and also do a course specifically devoted to HIV. And I've been involved in HIV work for at least 25 years, doing research, and also been active with Action for AIDS in various kinds of capacities.